I'll start off if you like. Okay, so today we're announcing that there's 14 new cases up until 8 p.m. last night. Of those 14, we have 11 in the Albury LGA, we have 2 in Federation LGA and 1 in Griffith. So they're the 14 cases. In terms of, there's a number of those have got epi links, so we know that they've got a link to some household contacts, others are under investigation. I think more importantly though, we're seeing a very good uptake of vaccination and boosters. Our vaccination rate for Murrumbidgee has gone well over the 97% for first dose, and our second dose completions are at 93% for Murrumbidgee. More pleasingly, where we've been focused, and that's where we spoke about last week around the 12 to 15-year-old age group, we have now got 83.2% first dose in that age group and 69.9% in that age group. So that's very pleasing. We did have a focus on that, in particular in the Albury area, and we're very pleased with the uptake in Albury, but also across Murrumbidgee. So vaccination we know is the best way to protect ourselves against COVID. So we are really encouraging anyone to come forward who is eligible, that is who have their second dose was 6 months ago or more, to come forward for a booster dose. So that's our big focus at this point for this week and moving forward. Come in if you are eligible, don't wait. We have plenty of availability and yeah, GPs, our clinics at Murrumbidgee, all are able to provide those booster doses. Yeah, look, it's good. Noting that the booster program, because you do wait the 6-month period, our first cohort was 1As and 1Bs. So they're our health workers and our emergency services back in that first lot of people that were eligible. So of that group, we've seen a very big uptake. The benefits of a booster dose are well documented, and we know that that will give people a increase in protection because at about the 6-month mark we know that the efficacy of the vaccine wanes to around that 50%. So if you do have a booster dose, you will have increased protection against COVID-19 at that 6-month mark.
Yeah, sure. And obviously, the vaccines picked up when the first doses and second doses were out at a certain point.
Yes.
When that comes to the 6 months from those, do you think there's going to be enough capacity, enough doses for people to readily access the booster dose?
Yeah, so we're very well stocked. We have great stock of Pfizer, and we're ready for that group of people coming through, because you're right, there was an increase in eligibility at a certain point in time. Therefore, our modelling shows that we will see an increase in people at certain parts of the year. So we're ready for that, and we've got the staff, we've got the resources, we've got the vaccine. So that's not something people will need to worry about. We're just asking people to get on that front foot and come and get their booster. And I mean, I suppose the other message here is too, if you're in that very small percentage of people who have not come forward for your vaccine yet, please come in. That's, our priority is getting through really those first and second doses as well.
And just on people in ICU at the moment, sort of off topic, but I think we have 1 in our region in ICU.
Yes.
Can you tell us which hospital they're in? How they're doing?
Yes, so we have 1 in ICU at Wagga. And that's, we can't comment on the condition, but certainly, we've got 1 in our ICU in Wagga.
And so how much protection do people receive from the booster doses, and how long does that last? Is it likely this will become an annual thing, people need to get a booster?
Yeah, so look, we know that, as I said, after that 6-month period, that wanes, the second dose wanes to about that 50% efficacy, protection. And when you do get your booster dose, it goes right back up to that 95% protection. So we know that we're seeing, good 12-month data from that. We're looking at Israel, of course, and the UK, who have already gone through this process. So I suppose it's just a matter of waiting and seeing what that does in those areas. So then we can obviously pick up that research and run with what we've got. So yeah, that's the answer to that.
And
Yeah, very normal side effects, and I think that's just after most immunisations or vaccines. Which certainly we haven't seen anything more than what we've seen in any other vaccine, so nothing out of the ordinary. But yeah, I think people just need to be mindful that very, very normal to have very mild side effects for that up to 7 days.
And just a general question about cases. For the past 3 days, we've had 14 new cases each day. Does it look like the cases are stabilising?
Look, at the moment, we're very pleased with the numbers. We've matched the resourcing though to what's happening in our environment. So you've seen increased testing in the Murrumbidgee, and that's what we have. We have a very good, agile, flexible model that will flex up as needed. So we saw that we took down the drive-through number of weeks ago, and when we've seen the cases increase here in Wagga, we've popped another one up to respond. So testing is good. We saw 358 people come forward yesterday for testing in the Wagga for Murray Street and the drive-through. So we're happy with those numbers, and we're seeing also we've got a presence down in Albury. People are still coming forward, and we saw we haven't even got a Wagga case today, but what I would say is people need to remain very vigilant. We will see those numbers go up and down. We are going to see visitors coming into the region, and as you know, the borders have opened up. With that, increases could have an impact on our numbers. So it's really, I suppose, a time for everyone to be very vigilant. Make sure you're checking in with those QR codes. We're hearing a lot of people saying, "Hey, I got a QR code, push notification," and that's good. People are taking note and monitoring for symptoms. So still, it's really important that people do those things around vaccination, QR code, testing, and that social distancing still, mask wearing. Yep.
Great that we have these booster shots available now so quickly, but there is still the lack of vaccines available for under 12-year-olds. Have you noticed any frustrations from people that you've spoken to, or perhaps why is it taking so long to get that approved?
Yeah, so we do get questions about when that will become available for those 5 to 11-year-old age group. Certainly, we're seeing the research come through and the approvals come through from overseas. We expect to see something happen early in the new year, and certainly we'll respond accordingly. So as soon as we have that information and availability from ATAGI and the TGA, we will move to provide that as well. So I still think though the important message for parents who have got children between the ages of 5 and 11, and we have seen a number of schools affected with that age group, so it's really important that one of the best protective factors for those parents is if they do have older siblings, to get them vaccinated. We know that that's a protective factor in this, and of course the parents to be vaccinated as well. So that would be my message to people, for people who are unable to access the vaccine in that age group currently, do other things that can support that level of protectiveness. Yep.
Do we want to move on to Albury, or have you got one?
I just had one more quickly. Just for those who might be a bit confused with the booster doses, is everyone who is eligible encouraged to come forward, or is this just for frontline workers and vulnerable people?
No, anyone that is eligible. The only rule of thumb we have for a booster dose is 6 months from your second dose. So from your last dose, if you had that 6 months or more ago, come forward for your third booster dose. Now, if you are an immunocompromised person, you don't need to wait that length of time. You don't have a booster, you have a third primary dose. You can come back 28 days after that second dose. So two distinct categories. One, the immunocompromised, and two, the boosters. 6 months is your only measuring stick. So come forward if you've had that 6 month break between them, and we can vaccinate you with your booster. I think, the important thing is that, we saw that in that first cohort, that 1A and 1B, we did have those, occupational and vulnerable groups who were eligible first. And there's a natural then booster doses will become eligible for them first. So we don't need to worry about, doing a cohort as such. Yep. Hence why they've just got the 6 month, time frame.
Yeah. Definitely.
Yep.
So do the figures in Albury show that it's sort of past that peak of the main outbreak we just had?
Well, we see there today there's 11. There's 11 cases, and we saw them quite high, up to 50, a couple of weeks ago. So that in itself tells us that the numbers are declining. However, it's still, we need to be very mindful that we've just, in neighbouring LGAs across the border, there are increased cases. So, that can change very rapidly. We're very pleased with the numbers, that's for sure. They certainly have shown a decline, and that's been absolutely up to that community and what they've done in response to the current risk in the community. So they came forward for testing in huge numbers, but they also came forward for vaccination. That 12 to 15-year-old age group, we saw a number of schools affected down there. They put their hand up and they came forward for vaccination, and we went to them, and we were very pleased with the response. So the Albury community should be extremely proud of the collective effort of being able to get those numbers to that level.
Yeah. And obviously, just because we're over one peak, it doesn't mean there won't be another outbreak to come.
Correct.
So I suppose you think you might be a little bit more prepared, having been through this one, and more vaccinations up.
Yeah.
Don't let it
Yeah.
go unseen. But
Yes. So certainly the vaccination is the biggest part of this, and it's a key to the outbreak in terms of how we manage it. Hospitalisations are what we're looking at, and as you can see, we have one person in hospital currently. For the numbers that we're managing, that's what we want to see. We want to see those very low numbers, and that's what we're interested in. Vaccination is wholly responsible for that. So vaccination protects people against those serious side effects of COVID and serious disease, and we're seeing that play out in practice. In terms of increased numbers into the future and planning, this is probably the biggest outbreak we've seen in Murrumbidgee in the last month, 6 weeks. So therefore, naturally, it gives us more skills in terms of how we've provided that response. But we are ready for anything, if we do see increased numbers. And we've managed very well up until now, and I think, given that, we're in a pretty good place.
sure.
Yep.
And, obviously, coming up to the Christmas New Year period, a lot of people might be thinking maybe I should get vaccinated because I need to get out and about and be safe doing so. Any message for people that are sitting on the fence?
Yes, there is a message. I think if you are contemplating vaccination and you haven't come forward, it's never been easier. There is no requirement to do a booking. You can just walk in. So just come into one of our clinics, come and get vaccinated. And if you are concerned, speak to your GP about what your concerns are about the vaccination. They're very well equipped to talk with you about any concerns. Certainly in the Murrumbidgee clinics, we have access to a medical doctor as well, who can see you at the time of your vaccination to discuss any concerns. So you will be getting increased visitors to your area. Households are going to be celebrating this Christmas. Really important that we give everyone the best protection we possibly can, and the way we can do that is by number one, with vaccination.